if you fear the sound of the drill when you go to the dentist, you are by far not alone. But what if you could walk into your dentist's office, never see a drill, and receive a more precise treatment that heals faster and is so much more comfortable? You can with laser dentistry, and joining us today is one of the founders of the largest dental laser organization in the world, Dr. Chris Walinski. Good morning. Thanks for being here.
Thanks, Greg. Thanks for having me.
All right, first of all, laser dentistry, I mean, it sounds really cool, but talk about what it is and the tools that you use to replace traditional dentistry.
Well, it's not an uncommon question because so often I ask that same sort of thing, because when I talk to even my colleagues, they say, oh yeah, we use lasers to whiten teeth and that sort of thing, but it's almost easier to talk about what it doesn't do than what it does do, because we can do fillings for cavities without using the drill. We can do gum therapy, periodontal surgery. We can help with implant placement. There's just lots of things that lasers can help us do.
Yeah, they can help you do, and with so much benefit for the patient. A lot less recovery time, a lot less discomfort and pain while they're going through the process as well.
Exactly. I think just in general there's a movement in medicine to go towards minimally invasive treatment, not just in dentistry. For instance, laparoscopic surgeries where they just use little tiny cameras and things, and the same sort of thing with lasers. It's very minimally invasive, so we only remove the diseased tissue. We leave all the healthy tissue, whether it be in a tooth or whether it be in a root canal or whether it be gum tissue, and that's why the patients heal faster.
And you brought one of your lasers. You have several. You brought one of them today. Talk about what this laser does and the procedures that you use it for.
The laser that I brought with me today is manufactured by WaterLase, which is right up the street in Irvine, and it's called a WaterLase MD because there's actually water that assists in the cutting. And so it looks very much like a drill, but it doesn't sound anything like a drill, and this can be used to remove diseased gum tissue, or we do our fillings every day with this particular machine. So rather than hearing the whine and the vibration of the drill, we use this instead, and it just does a whole lot better job.
Yeah, and we were talking. There's really nothing that can clean out diseased gums better than a laser. I mean, the technology that it provides and the benefits of the patients is just, it's so much more advanced than it was, say, 10 or 20 years ago.
Absolutely, and it's not just with gums, even with teeth. If you've ever had a filling done and then for the next couple of weeks, every time you bite on it, it's a little bit sensitive, that's the result of the drill. The drill will cause little cracks in the tooth because of the vibration, and it also leaves what's called a smear layer. It leaves an area of dead tissue because it spins around, and the laser completely removes that, and so the fillings last a lot longer and they're less sensitive.
We're seeing some of the before and afters. Walk us through what we're seeing right here.
Well, here this young lady came in with some, it's normal pigmentation. There's nothing wrong with her gums on the left, but you can see that they're obviously discolored. She didn't like that, and the picture on the right is exactly 7 days later. What's neat about this is it was done actually with this laser here, and it was done with only topical anesthetic, which is only that jelly that you put on with a Q-tip. In this case, the young lady came in for some Invisalign to close that space between her two front teeth, but obviously she's got some other issues there. And again, this is immediately post-op. You can still see a little bit of the cotton fibers from the gauze on the right-hand side. That's what the tissue looks like. It's not burned, it's not charred, and it's not bleeding, so that's why patients heal faster. And then in this case, this is a lot more involved because it involved also cosmetic dentistry as well, but lasers can help us to adjust the bone and the gum, and the end result is a whole lot more satisfying, I think, to the patients.
All right, so people at home are, they're looking at those before and afters and thinking, it looks great, but, as you know, with the economy the way it is, cost is a determining factor for a lot of people these days. But you say laser is exactly the same cost as traditional dentistry.
Exactly. The savings comes in the form of time. It takes me less time to do your filling, so I don't need to charge you any more. And in fact, if you look at the insurance codes, there's no insurance codes for lasers. So if you submit for a filling, whether you do it with a drill, you do it with a laser, it's the same cost. If you do gum surgery, it's the same cost. There's really no difference in the cost. But you're right, that's a big misconception.
All right, if people want to get a hold of you, Dr. Walinski, the number's on the screen, 619-49-SMILE, or they could just go to the website, zendentistry.com. Talk about some of the common procedures if people are thinking about calling right now. Maybe they have some diseased gums, or they want to close the gaps, whatever they need. Talk about some of the common procedures that the laser that you would use with the laser.
Well, I'll tell you, one of the big ones is for gum surgery. A lot of times You go to your dentist or your hygienist will tell you that you have some gum disease, you have some pockets, you need to go to the periodontist. And oftentimes you'll go and the traditional surgery is to use a scalpel and actually peel, I don't mean to be gruesome, but peel the gum away from the bone and drill out the bone. And I know people are getting all the willies up and down their spines, but using a laser, it specifically seeks the diseased tissue. So all you do is take a little tiny fiber, put it down in between the gum, and it will actually remove the diseased tissue and kill the bacteria. So that's a huge one right there.
And you have a great grand opening special. If people want to call right now, if they need, whatever the service is, whether it's, with the laser or, or without, I know you pretty much work exclusively with lasers. You've been doing that for over 10 years. Yes. But if people want to call, you have a great special. Tell us about it.
Well, what we're doing for the month of June, because it is our grand opening, is to offer, normally we always offer complimentary consultations. So if anyone wants to come in for a second opinion or you want to know how a laser might be able to affect or help you with your specific case, there's no cost for that. But for the month of June, we're also offering 50% off any procedure. So I wouldn't waste that on an exam or a cleaning. If you need to have a crown, a root canal, an implant, even Invisalign, we'll take 50% off of that.
So half off any service to the first 25 callers,
yes, right? There's a limit, yes.
There you go. 619-49-SMILE. Dr. Chris Walinski, thank you so much for coming in. It was a pleasure.
Thank you so much, Greg.
All right, we'll see you again soon.